Okay, this is part 3 of the Wendan Tang cases. Wendan Tang is warm gallbladder decoction, and in this episode, there are a number of various conditions. There's nothing that really holds this thread together, but there are things that didn't fit in the other ones. So here we go. I talk about the ingredients of Wendan Tang in the first in this series, and we're up to 3. There'll be 4 total. So under abnormal uterine bleeding, which in ancient Chinese is called flooding and spotting, then we've got a case from Gujin Yi An, a Qing Dynasty collection of cases. And somebody who's more commonly known as Sun Yi-kwei, Ming Dynasty doctor, late Ming Dynasty, treated somebody's daughter-in-law, some famous person, his daughter-in-law. She had irregular menstruation, and doctors had given her prescriptions to calm the fetus for more than 7 months. So, at first it didn't make sense to me. And then I realized she had irregular menstruation, so they thought she was pregnant. And because she had various things going on, they gave her herbs to calm the fetus. We'll see. Do we think she was pregnant or wasn't pregnant? We'll see. But they must have thought she was pregnant to give her those herbs. Her menstruation suddenly strongly moved. So she started bleeding really heavily. They're calling it menstruation. We have to decide. Internally, she had 1 or 2 clots of blood and a sinewy membrane the size of a hand. This sounds more like a miscarriage to me. Anyway, she was swooning and muddled and exhausted because she lost so much blood. Her right guan pulse was flooding and slippery. The left cun was flooding and rapid, and both her pulses were flooding and large. So flooding, 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 that sounds excess. There's some excess going on. At midnight every night, the patient gnashed her teeth and raved. Her palms were hot, her jaws clenched. Sometimes her hands and feet were cold. Her heart was distended and oppressed and uncomfortable. Her complexion was green. All the doctors said this was difficult to treat. And what that means is they thought she was going to die, so there's no point in getting involved. So Sun Yi-kwei comes and says, those guys, they don't know what they're doing. There's nothing to fear because I am here. He was a really arrogant person. I don't like him much, but sometimes his cases are interesting. Anyway, he said, this is turbid phlegm flowing into the sea of blood, causing stagnation. So remember, there was like weird stuff, not just blood, but some other stuff came out. So I guess he thought that was phlegm. She has erroneously taken prescriptions to calm the fetus, which made the stagnation even worse. So, calm the fetus is probably going to astringe and hold in, which will make stagnation worse if that's what the problem is. She lost a lot of blood, so her shen and her hun have nothing to anchor themselves to, nothing to stabilize them, nothing to depend on. And phlegm is enchanting her heart orifices because she's ranting and raving and so forth. So the shen swoons and she raves. The episodes occur at midnight. This is phlegm heat in the Xinbao Luo, which is related to the pericardium and the gallbladder channel. Well, the gallbladder channel is 11 p.m. to 1 a.m., but the pericardium channel is a little bit earlier. Anyway, so there are episodes every time midnight arrives. We will regulate qi, open phlegm, calm the shen, and nourish blood, and then she can live. So I guess he's saying gallbladder channel because the time it occurs, but pericardium channel because this is like heat collapsing into the pericardium. So she's raving. It may be that he's talking about the pericardium organ, not that it's really an organ, and the gallbladder channel. Anyway, he then gave her Wendan Tang, adding some other herbs, Shichangpu, which is good for consciousness issues, wine process Huanglian to clear heat and cool the blood, but not too, intensely because they wine processed it to make it a little more mild. Tianma for the wind, Suanzhao to calm, and Danshen to move blood stasis. That night at the Zi and Chou hour, so that's 11 p.m. to 3 a.m., the gnashing of her teeth and the raving both were half as strong as they were the day before. So the next day he kept giving her the above medicine and he added some juru to each packet. And at bedtime, he also gave her several grains of some other formula. I don't know what it is, but it's probably something we can't take because Dan formulas are usually minerals, and this has, it's like black tiger elixir or something like that. And so it's probably something toxic. Anyway, all of her conditions were completely gone and she recovered. Okay, so that's the first one where Wendan Tang is used for something that seems like a little bit different. Here is another one. This person's also named Sun, but it's a different person. So this person, Sun Juye, contracted summer heat while he was on a journey. He was also damaged by wine. He had been drinking a lot and then he got summer heat. And so he was vomiting and he had glomus oppression of the chest and diaphragm. In other words, he felt like some pressure inside, like there was something there that shouldn't be there, but it's just some kind of chest oppression type thing. Okay. The doctor used a prescription to disperse and abduct food. That means to make the food keep moving through the system, including the wine. But that made dryness and that stirred up spleen fire. Spleen fire, that's not something we talk about today. We would say stomach fire, but here it says spleen fire. Sometimes in the old days, they had conditions that we don't really talk about today. So he had thirst, clamoring stomach, meaning, your stomach feels like it needs food, but it also doesn't feel good. It's not just like regular hunger, like, yeah. Agitation and an unsettled feeling. His eyeballs looked golden and his whole body was very yellow. This had become jaundice. So his right Zun pulse was slippery because jaundice always involves damp. It was also large and forceful. So this is yang jaundice. There's summer heat, there's wine. It's excess. It's not yin jaundice that's due to extreme deficiency. Well, they use Wendan Tang, adding shangru, which is this cold in the summer heat form, herb, huashe, which, gets damp heat out of the body, and gugun, which is probably used against the wine. They use that to resolve summer heat and stop vomiting. Yeah, gugun also stops vomiting, but due to wine may be part of it. They use those as the sovereigns along with Wendan Tang. Huanglian and Maimendong were used to clear heat and stop thirst as the ministers. This would make the damp heat dissipate and cure the jaundice without further intervention. Just do that and everything should turn out okay. He took 3 packets and the vomiting stopped, and then he could eat. And then they gave him 8 doses of Wuling San, which they added Qinghao, Gugun again, Huashe again, Huanglian again, and Zhishi. And the jaundice was completely gone. Okay, I'm not going to try and analyze all those herbs. If you're good at herbs, you can pause the video and look at the herbs and see what you think. Okay, this last set for this episode is under cold damage or Shanghan in Gujin Yi An, this collection of cases from the Qing dynasty. Although the cases are often earlier, like these are Ming dynasty cases, all from somebody named Wu Shou, who I don't really know who he is, but there are 3 short cases about spasms after cold damage. So somebody gets wind and cold invasion and it progresses and it ends up with some wind and spasms and stuff like that, internal wind. But each of these three cases uses a different formula because the author wants you to really see how similar diseases have different treatments based on, the particular pattern of that patient. So this Dr. Wu treated someone with cold damage who hadn't sweated. Okay, so, cold invaded, it closed the pores, there's no sweating, and nobody made him sweat. 7 days after that began, his channel vessels were stirring and jerking. In other words, he's having neurological spasms, not muscle spasms, like twitching and stuff that's neurological, internal wind. When tidal fever came on, it was especially severe. His flesh was not twitching. So this is a little weird, but I think what it is that somehow they're able to identify that the stirring and jerking, the twitching is happening in the channels, but not in the flesh. How do they determine that? I'm sorry, I don't really know. He had bound up stool that would not move. So he's really constipated. His urination was red and rough. So this Dr. Wu pressed the sides of the patient's umbilicus. It was hard and painful. He had dry stool inside. So Wu Shou used a modified Da Chai Hu Tang to descend him, which means induce a bowel movement, and this patient recovered. So seems more like they should have used Chungchi Tang, but that's what it says. That's what it says. Okay, so that's the first case of some kind of spasms after cold damage. The second case, another person suffered cold damage for more than 10 days. He had already been made to sweat excessively. So this is different than the previous case because in the previous case, he never sweat. But now this person has been made to sweat 3 or 4 times too much. It then mutated into twitching flesh and shaking body. So now he's having convulsions. The sinews and vessels stirred and jerked. The reason was that excessive sweating made qi and blood both deficient. He lost sweat and blood are very closely associated. So when he sweat so much, it made his blood deficient. And also when you sweat, qi leaks out with the sweat. So Wu Shou used a modified Renchen Yangying Tang, so, a more supplementing formula, and the patient recovered after 2 packages. The final one, which will involve Wendan Tang, after sweating, another person had deficiency, vexation, and insomnia. His sinews were jerking and his flesh was twitching. The interior had heat. So Wu Shou used a modified Wendan Tang and the patient recovered. Okay, so that's kind of a question mark, but I have one more slide to show you that may answer why Wendan Tang. The moral of these 3 cases is that one can see the deficiency and excess are different. So how can someone hold on to only one theory when enacting treatment? In other words, you've got to treat each of these cases differently, even though superficially, they have the same chief complaint, cold damage, and then some kind of spasms or convulsions, but the circumstances are very different. So this last one, he's very deficient after sweating. He still had some heat, so modified Wendan Tang. So what's that all about? Okay, one of the early versions that's called Wendan Tang, but doesn't have Fuling in it. So it's not exactly the same as our Wendan Tang, is from a book called Wai Tai Mi Yao by Wang Tao. And it quotes from an earlier book, Ji Yan, which that book is lost, but it's talking about Wendan Tang from that book called Ji Yan. It treats deficiency, vexation, and insomnia following a serious illness. That's what the previous slide had: deficiency, vexation, and insomnia following a serious illness. And so this is gallbladder cold, he says. So one should warm the gallbladder with this formula. So the book that's mentioned is an earlier book that's lost. It was by somebody named Yao. I think this is supposed to be a picture of that person named Yao. So the book was lost, but one of the things about this Wai Tai Mi Yao is that it quoted from so many earlier books, and it also gave attribution of which book it came from. He didn't just write it down. Many Chinese authors would, copy stuff from previous books, but not mention the source, which of course today we would call plagiarism, but a few doctors would really, they didn't think it was plagiarism, but a few doctors would, give the sources, and that's really useful because now we know a little bit more about this Jian Feng, even though that book doesn't exist anymore. Well, anyway, there's going to be one more episode of Wendan Tang because there's one more case that's really pretty long. And so that will be the fourth episode. So that's that.